Welcome to the Mary Immaculate Hospital Virtual Spinal Surgery Seminar. My name is Debbie, and I'm the Orthopedic Nurse Navigator at Mary Immaculate Hospital. I want to thank you for choosing Mary Immaculate Hospital to help restore you to a higher quality of living after your spinal surgery. This presentation will help to outline the surgical process, from how to get ready for surgery all the way through how to recover completely at home. We will provide clear expectations regarding your orthopedic care. You play a key role in ensuring that you have a successful recovery. Our goal is to involve you in your treatment through each step of the process. Your education and the following information will help to ensure you have a safe and successful surgical outcome. Please feel free to contact myself or Shannon Dietrich, our orthopedic coordinator, with any questions about this presentation or your upcoming surgery. We work closely together and are here to help you. Pre-anesthesia testing. Once you and your orthopedic surgeon have agreed that surgery is the best option for you, your surgeon's office will send information to our pre-anesthesia testing department, also known as our PAT department, regarding your surgical procedure. From here, you will be scheduled for preoperative testing and a preoperative nursing interview. You will receive a phone call from our pre-anesthesia testing staff 3 to 4 weeks before your surgery to schedule your nursing interview and to receive your chlorhexidine gluconate cleansing solution, also known as CHG solution, to use 3 days before surgery. During this important scheduled time with the PAT nurse, you will be asked to share your medical history, your surgical history, your allergies to both foods and in medications, and your daily medications, including vitamins, herbal supplements, and anything over the counter. Be sure to have the bottles available for this interview so that you can provide the medication name, dosage, and frequency. Your personal medical history will determine what preoperative testing you will need prior to surgery. While your nursing interview must be scheduled, your medical tests may be completed without an appointment within 30 days of surgery. Common tests include lab work, which is non-fasting. This means you can eat and drink prior to the lab draw, an EKG or electrocardiogram of your heart, and a potential chest x-ray and/or urinalysis. The results of your test will be sent to your surgeon, and you will be contacted if the test results are abnormal. It is also best to undergo a complete physical examination with your family physician within 30 days of surgery. Your surgeon will let you know if this is a requirement before surgery. If you have any high-risk medical conditions or see a specialty doctor, you may be required to obtain surgical clearance from these physicians, to include cardiologists and pulmonologists. 7 days before your surgery, you will be asked to come back to Mary Immaculate Hospital, drive through the surgical pavilion to get your COVID test. Once you have your COVID test, you will be asked to quarantine until your surgery so that you are safe. Pre-anesthesia testing. During your PAT interview, you will be instructed on which medications to stop taking and which medications you can continue to take based on your surgeon and anesthesia requirements. All herbal supplements should be stopped 14 days prior to surgery. As for pain medication, all non-steroidal anti-inflammatories, also called NSAIDs, whether they're pills or cream, are generally requested to be stopped 7 to 10 days prior to surgery due to the increased risk of bleeding when taking these medications. Examples of these medications include Aleve, Motrin, Advil, Mobic, Celebrex, and Vytorin. Check with your surgeon regarding when to stop these medications. Also, after surgery, check with your surgeon before you take any NSAIDs. Medications you may take instead for pain include Tylenol, which is acetaminophen, hydrocodone, oxycodone, Percocet, Vicodin, Tramadol, gabapentin, and Neurontin. Anticoagulants or blood thinning medications are generally requested to be stopped in the weeks leading up to surgery. Examples of blood thinners include Coumadin, Plavix, Pradaxa, Effient, Xarelto, Eliquis, and aspirin. Check with your surgeon and prescribing physician regarding when to stop these medications. You may get your flu shot prior to surgery. If it is flu season and you have not had your flu shot, your nurse will ask if you would like it administered to you during your stay at the hospital. Please consult your surgeon regarding additional vaccinations. Preparing yourself for surgery. This starts with picking a coach. A coach is a friend or a family member, but should be someone who can help you get ready for surgery and be with you the first few days after you recover at home from surgery. Your coach should be educated regarding your surgical preparation. Have your coach watch this video from the hospital too, so that he or she can help you stay on track for getting ready and during your recovery after surgery. Stop smoking. Smoking increases your risks of lung complications during and after surgery. It also increases your risk of infection because it decreases your healing process. If you need assistance with quitting smoking, please contact your primary care doctor. If you aren't ready to stop smoking yet, try to cut back prior to surgery, and do not smoke the night before or the morning of surgery. Stop alcohol intake, or at a minimum, limit your alcohol intake at least 2 weeks before surgery. After surgery, check with your doctor before resuming alcohol intake. Also, while you're taking narcotics, do not drink alcohol. Eat healthy. Eating healthy is important for healing after surgery. Maintaining a healthy diet decreases the risk of heart disease, high blood pressure, and diabetes. It also decreases the risk of infection. Prepare and freeze or purchase small portioned healthy meals for times you may be alone. www.choosemyplate.gov is a great online resource to learn more about proper nutrition. There is also an additional nutritional tip sheet in the appendix of your education booklet. Create a safe home environment. Don't fall or trip. Make sure that you install hand railings where necessary, especially on stairs. Check any existing handrails to make sure they are secure. Remove any tripping hazards, such as throw rugs and long cords. Arrange your furniture so that you can easily move about your house with a walker. Place items you use every day in the bathroom and the kitchen on the counter so that you do not have to bend down or reach up to grab them. The more you set yourself up before surgery, the better you'll do after surgery. Packing for the hospital. As you know, advances in orthopedic surgical practice have resulted in an increased number of patients who may be discharged from the hospital on the day of surgery. Ask your surgeon if he plans to safely discharge you on the day of surgery versus spending the night in the hospital so that you and your family are aware of the plan. Even if you plan on discharging on the day of surgery, it is best to have a small overnight bag packed and left in the car in the event that you may stay. You should include loose-fitting clothes such as gowns or loose pajamas that don't drag on the floor, rubber-soled shoes that tie easily or slip-on shoes with a back, no flip-flops or sandals, personal hygiene toiletries, cases for eyeglasses, dentures, and hearing aids, supportive devices such as a CPAP machine, a list of medications you are currently taking, including frequency and dosage, a method of payment for prescriptions. An outpatient pharmacy is located in the hospital for your convenience. A copy of your advanced medical directive. If you need more information about advanced medical directives, you can look at the appendix in your educational booklet or ask to speak to a chaplain when you come to our hospital. Don't forget to label all your belongings. If you need your walker adjusted, plan to bring it so physical therapy can fit it to your height. If it's already adjusted to your height, leave it at home and you can borrow one in the hospital while you're here. Countdown to surgery. 4 weeks prior to surgery, schedule your preoperative physical and plan a day that you'll come and have your preoperative lab work and tests. Plan for our anesthesia department to call you to schedule your nursing interview. Begin prepping your home for safety. Eat 3 meals a day that are healthy so your body is healthy and strong coming for surgery. 10 to 14 days prior to surgery, stop taking medications as instructed by your physician. Stop drinking alcohol and smoking. Begin preparing healthy meals to freeze and reheat after surgery. 3 days prior to surgery, begin using your chlorhexidine gluconate or CHG skin cleansing solution. Follow the instructions provided for showering 3 days prior to surgery. Do not use any lotions, perfumes, or deodorants for these 3 days. The day before surgery, pack your items for the hospital. Surgical time and check-in location will be provided by the surgeon's office on the afternoon prior to surgery. Remember, do not eat or drink anything after midnight the night before surgery. The day of surgery, make sure to brush your teeth and clean your tongue and rinse with water, but do not swallow the water. Take only the medications you have been instructed to take during your pre-admission interview with a sip of water. Wear proper clothing that is loose-fitting and easily removed. Remember, no deodorant or lotion. Remove all jewelry. Please leave all your jewelry and valuables at home. And do not smoke the night before or the day of surgery. Reporting to the hospital. You and one visitor report to the main desk on the ground floor of the surgical pavilion located adjacent to the emergency room. After you arrive to the hospital with a mask on, you and your visitor's temperature will be checked. You will be escorted to the pre-op area while your visitor is put in the waiting area. Once you are ready for surgery, your visitor will be allowed to sit with you until it is time for you to go back for surgery. In the pre-op area, your skin will be cleansed with CHG wipes and your nostrils swabbed with an antiseptic to help prevent infection after surgery. You will be provided a hospital gown and a new mask. Once you are in the bed, a warming blanket will be applied to make sure your temperature remains normal. This also helps to prevent infection after surgery. Your nurse will review your medical history, medications, allergies, and update any medical information for surgery. Your nurse will insert an IV along with take your vital signs. Lastly, you will meet with your surgeon and anesthesiologist to sign any consents for surgery. This is your time to ask any last-minute questions and to discuss any previous problems you have had with anesthesia. After meeting your surgical team, medications like antibiotics and fluids will be administered via your IV line. Other medications may be given to alleviate any anxiety you have. If you wear dentures, glasses, or hearing aids, you will need to remove them at this time. Anesthesia information. You will meet your anesthesia care team, which consists of an anesthesiologist and a nurse anesthetist. They are responsible for your comfort and well-being before, during, and immediately after surgery. They will meet with you before surgery to discuss your anesthesia plan for the day based on your health history, medications, and personal needs. Decisions regarding the type of anesthesia, gases, and medications used will be made by your anesthesia care team. Please make sure to let them know if you have had any problems with anesthesia in the past or get nauseated easily. General anesthesia will be used for your spine surgery. Your anesthesia care team will put you to sleep using an anesthetic gas. Once you are asleep, they will insert a tube into your mouth and lungs to breathe for you while you are sleeping during surgery. They will give you medications through your IV during surgery to help prevent nausea, pain, and make sure you remain asleep until your surgery is done. With this type of anesthesia, you will be unconscious throughout your procedure. As you awaken and are taken to the post-anesthetic care unit, medications will be given to help manage postoperative pain and nausea. Surgery. Once it is time for your surgery, the OR team will take you by stretcher to the OR. You will be assisted to slide onto the OR table. You will have monitors applied to your body while you are asked to take deep breaths to get ready for anesthesia. Once you are asleep, the OR team will conduct a timeout to review your information and consents to make sure you are safe for surgery. If you want to know how long your surgery will take, make sure to ask your surgeon before surgery. Post-anesthesia care unit, PACU. Once your surgery is over and you start to wake up, you will be taken to the PACU, also called the recovery room, where you will continue to be under the care of your anesthesia team. Your vital signs will be observed closely as the effects of anesthesia begin to wear off. Early on, you may feel sleepy, dizzy, or even confused. It is not unusual to be groggy for the remainder of the day. After you have been deemed stable by your anesthesia care team, you will be moved from the PACU to a room where you will recover under the care of your surgeon and our nursing staff. If you are spending the night, you will be moved to a room on 2 South Orthopedics. If you are going home the day of surgery, you will be taken to the Phase 2 discharge unit. Make sure that your coach stays with you the first 24 hours after surgery due to the effects of anesthesia once you get home. What to expect after you wake up. Pain management. Pain is a normal part of recovering after surgery. Your care team will work with you to help you have pain tolerance. Pain tolerance means you can change positions, walk, dress, bathe, and go to the bathroom while you have pain. Please set realistic expectations for yourself so that you do not get frustrated after surgery. Yes, you will hurt, but you will still have to move. Your nurse will work with you to establish pain goals to help ensure that your pain is tolerable, but do not expect to be totally pain-free. Pain medication, ice, changing positions, distraction, maintaining back or neck precautions, and walking every hour while you're awake help to decrease stiffness and soreness which help with pain control. Vital signs will be assessed every 4 hours by your nurse or nursing assistant. IV fluids will be given to help hydrate your body after surgery. Antibiotics will be given intravenously for the first 24 hours after surgery to prevent infection. If you go home the same day as surgery, you may or may not be given a prescription for oral antibiotics to finish up. Sequential compression device, SCD, are sleeves that wrap around the legs and fill with air one at a time. This air movement imitates walking, promoting blood circulation, which helps to prevent blood clots. Keep these on while in the hospital bed. They will be removed when you get up to sit in a chair or walk. Support stockings, TED hose. After surgery, support stockings may be placed on both legs if your surgeon orders them to be placed there. These are to promote circulation and ease swelling. You will wear them daily, removing them overnight only until your follow-up visit with your surgeon. Incentive spirometer is a device that will help to exercise your lungs to prevent fluid buildup and decrease fever after surgery. Use this device 10 times an hour while you're awake for the first 2 weeks after surgery. It is normal to cough the first couple of times you use the incentive spirometer. Back brace or neck collar. The back brace or neck collar provided by your surgeon should be worn as instructed. This is to help provide support to ease pain and make sure you do not move wrong after surgery. Occupational therapy. An occupational therapist will see you as needed to assess your ability to perform daily activities such as bathing and dressing. In working with you, they will determine if you need some assistive devices to help you with grooming and dressing. Physical therapy. You will get out of bed as soon as possible after surgery to get you moving toward recovery. A physical therapist or your nursing care team will get you up within the first 2 hours or sooner of arriving to your room. A physical therapist will work with you to ensure that you are practicing safe mobility, to include using a walker and managing stairs. Medication review. While in the hospital and upon discharge, you may be receiving several different types of medications to help you recover after surgery. Let's review them. Pain medication. Your doctor will choose pain medications that are appropriate for you. It is common to receive narcotics, Tylenol/acetaminophen for muscle soreness, Neurontin/gabapentin for neuropathway pain, and a muscle relaxer to ease the tightness in any of the muscles around your surgical site. You will be prescribed one or all of these to help provide you with pain tolerance after surgery. Make sure you tell your care team what your pain level is using the pain scale shown below. The pain scale allows you to rate your pain using a number from 0 to 10. Each number represents a degree of pain, 0 being no pain and 10 being the most excruciating pain you can possibly imagine. If you rate your pain 5 or less, then you should use non-narcotic medications such as Tylenol to manage your pain. If your pain starts to go higher than a 5, you may want to take a pain pill. Sometimes after spine surgery, you're having muscle tightness in your back and neck, not true pain. If you're having tightness, it may work better to take the muscle relaxer to help relax the tension in the muscles, which will help ease pain. Remember, do not take a muscle relaxer and a narcotic at the same time. Stool softener. Pain medications and anesthesia will make your bowel slow down. A stool softener, such as Colace or Miralax, will be ordered by your surgeon to help promote bowel movements. Remember to stay hydrated and to continue taking stool softeners once you get home. Daily medications. Your routine daily medications will be provided if you remain in the hospital. A pharmacist will review them to ensure there will be no interactions with the medications your surgeon prescribes for surgery and your daily medications. Outpatient pharmacy. Mary Immaculate Outpatient Pharmacy is located on the first floor of the Medical Arts Building. You will be provided with the opportunity to fill your medications at our outpatient pharmacy, or you may fill your prescriptions at your home pharmacy. We do encourage you to use our pharmacy to make sure you have all the medications you need when you get home. Unfortunately, occasionally we have patients that have had trouble filling their prescriptions at their normal pharmacy when they've left the hospital. If you choose our pharmacy, transportation will take you by the pharmacy on your way out of the building. Please note that filling prescriptions at the Mary Immaculate Hospital Pharmacy is for your convenience, so you do not get home without your medications. This does not obligate you to refill medications here. Risks to avoid after surgery. The best way to prevent risks after surgery is to get up and walk every hour while you're awake. We know your neck and back will be sore, stiff, and painful after surgery. However, you must move through the pain. Some of the risks you can prevent include blood clots. Blood clots can sometimes occur after spine surgery. They can happen in either leg from not moving after surgery. To prevent blood clots, do ankle pumps 10 times every hour while you're awake. Change positions from sitting to standing every hour, and make sure to walk short distances every hour while you're awake. Wear your SCD hose while in the hospital. Make sure to wear your TED hose during the day and the evening, and take them off at night to help prevent blood clots. Warning signs of a blood clot include sudden swelling in one calf that makes your leg feel tight like a balloon. Redness and warmth to touch are other signs. Call your surgeon if you notice any of these signs. If you develop extreme shortness of breath while resting or pain to your chest when taking a deep breath, this could be a blood clot too. If you can't catch your breath while resting or have chest pain, please call 911 and go to the emergency room. Do not get in a car. Constipation. Constipation is a common side effect of narcotic pain medication and anesthesia. Ways to prevent constipation are walking, drinking lots of fluids, about 8 glasses of water a day, and taking a stool softener twice a day. If you do not go home with a prescription for a stool softener, please purchase an over-the-counter stool softener at our outpatient pharmacy on the way home. If your bowels do not move by 2 days after surgery, make sure to increase your stool softener or take a laxative. Pneumonia. Pneumonia is caused by the buildup of fluid in the lungs from not taking deep breaths. To prevent pneumonia, get up and move every hour while you're awake. Use your incentive spirometer 10 times an hour while awake. Infection. Infection is a risk with any surgery. To prevent infection, keep your incision covered as instructed and dry. Do not apply lotions or ointments. Shower as directed by your surgeon. Notify your surgeon or home health nurse if there is an increase in drainage, redness, pain, odor, or heat around the incision site. Take your temperature if you feel warm, and call your surgeon if your temperature exceeds 100.5 degrees Fahrenheit. Wash your hands. Ensure that you, your family, and your healthcare providers are all practicing proper hand hygiene. Warning signs of infections include persistent fever, changing in color, drainage, amount of drainage, redness all around your incision site. If you experience any signs of infection, please call your surgeon or home health nurse immediately. Precautions. You will have to follow moving precautions after your neck or back surgery to help ease the pain after surgery and promote healing. Wear your neck collar or your back brace following your surgeon's instructions. You must wear your collar or brace when walking or changing positions. Also wear it while you are sleeping to help you maintain proper alignment. At your first post-operative checkup, you can ask your surgeon how long you will need to wear your neck collar or your back brace. If you had neck surgery, do not turn your head from side to side, up and down, or ear to shoulder. Do not raise your arms above your head or lift anything greater than a gallon of milk. It is helpful to drink everything through a straw so that you do not look down. You may need a walker at first when you are moving around your house because you cannot look down when you are walking and it can throw your balance off. Make sure to sleep with your head above your heart on pillows or in a lounge chair to prevent swelling in your neck, which can make it hard to breathe and swallow. Trouble swallowing and throat pain are normal after surgery, so don't panic. The more you swallow, the better you'll feel. If you are having back surgery, try not to bend or twist at the waist. Do not lift anything greater than a gallon of milk. Log roll to get in and out of bed to stabilize your back. If you are not sure what it means to log roll, you can find videos online or ask your physical therapist. It is often hard to get in and out of low surfaces, so make sure to sit in chairs with armrests. If the chair is too low, you can use pillows to elevate the seat. Make sure your toilet is not too low so you do not have trouble getting on and off of it. You may need to buy a bedside commode or a raised toilet seat before surgery to help you once you get home. What to know if you wake up with a drain. Your surgeon may put a drain in your neck or back to drain the fluid to prevent accumulation right after surgery. If you stay in the hospital, your surgeon will tell the nurses when to remove the drain before you go home. If you leave the day of surgery, you will go home with the drain in place. But don't worry. The nurses at Immaculate Hospital will teach you how to manage your drain at home. While you have your drain in place, leave your neck collar or your back brace on to help support it so that it doesn't pull loose. The day after surgery, If you go home with the drain in place the day after surgery, your surgeon will have you come back to the office to have the drain removed, or your surgeon will arrange for a home health nurse to come out and remove the drain the day after surgery. If you get home with a drain and you're not sure what to do, please call your surgeon's office the morning after surgery to get clarification. You do not want to keep the drain in any longer than your surgeon wants you to. If a drain stays in too long, it can actually cause problems. Home health care. Our goal is for you to recover at home, continuing your physical therapy and related care in more familiar surroundings. Your surgeon may feel that it is beneficial for you to have home health. If so, home health services will include a physical therapist and a nurse, and this will be arranged for you. If you spend the night at Mary Immaculate Hospital, our care manager will visit you to discuss home health care options. If you go home the day of surgery, your surgeon's office will have already set up home health care to come see you. If you get home and no one from your home health agency has called you by 11 o'clock the day after you get home, please look at your discharge instruction sheet and call your home health agency to see when they're coming. If you're not sure who your home health agency is, call your surgeon's office to find out who they are and let them know that you have not heard from your home health agency yet. Before we end our presentation today, I want to address some frequently asked questions. When can I take a shower after surgery? Showering after surgery is dependent on your surgeon. Specific instructions will be provided to you upon discharge. Sponge bathing may be necessary in the immediate postoperative period to ensure your dressing stays clean and dry. Saran wrap or press and seal are great ways to keep your incision area dry once you're allowed to take a shower. When will I be able to get back to work? Your surgeon will let you know when you will be able to return to work, but it greatly depends on your recovery and your occupation. You will follow up with your surgeon 7 to 10 days after surgery and can discuss your return to work at this time. This is also the time to discuss when you can begin driving again. How long will I wear my brace or collar? The neck collar or the back brace should be worn until your surgeon clears you to stop wearing it. Have this discussion at your first post-op checkup. How long will I need narcotic pain medication? Pain is very patient-specific. The average patient can alternate between Tylenol and narcotic pain medication within the first few days of having back surgery. Keep in mind that ice, moving, and changing positions, distracting your brain, are key ways to also help control your pain. Controlling the swelling in your back and neck will help to lessen the pain. Remember, do not take NSAIDs until your surgeon allows you to take them. Thank you for choosing us at Mary Immaculate Hospital for your spinal surgery. We look forward to meeting you and helping you on your road to recovery. Please call myself or Shannon with any questions, comments, or concerns. We are here to assist you to have a successful recovery.